Today we would like to talk about antimicrobial resistance and the effects it has on public health. Antimicrobials are drugs that are made to treat and prevent infections in all living things such as people, plants, and animals. Some examples of these drugs are antibiotics, antiviral medications, antifungals, and antiparasitics. Antimicrobial resistance is a growing problem globally. It happens when medications don't have significant effects on bacteria, fungi, parasites, and viruses that cause infections, making them harder to treat and cure.
There are four main causes of antimicrobial resistance. Those four causes are incomplete antibiotics, lack of infection control, overusing antimicrobial treatments, and lack of prevention control. Antimicrobial resistance is a problem because it causes severe illness, increased mortality, and increased prevalence of illness.
Some examples of antimicrobial drug-resistant illnesses are tuberculosis, candida, salmonella, shigella, and MRSA. Public health significance of antimicrobial resistance.
A global response from public health. Public health globally recognizes the significance of antimicrobial resistance and breaks it down into two perspectives. AMR is a global public good, meaning it is absolutely impossible to exclude people from benefiting containment of AMR because one person who benefits does not stop another. One perspective of significance is that resistance is bound to be suboptimal, meaning many people rely on antibiotics and public health does recognize the needs for AMR. Globally, public health signifies the avoidance of AMR emerging and that the battle can only be achieved through international collective actions. Public health surveillance is essential to healthcare infections and antimicrobial resistance because it tracks the changes in microbial populations, early detection of strains, and handles notifications and investigation outbreaks. For example, WHO has global surveillance such as the alert organism tracking, enhanced routine surveillance, and targeted surveys.
Public health aims and goals.
Because hospital and clinical settings are areas where antimicrobial resistance is at most prominent, I have come up with a plan of creating an implementation system where there is periodic servicing of the hospital provided by the CDC. This servicing shall be held on a bi-weekly to monthly basis depending on how severe the cases are. In the event that there's an outbreak, whether in the community or hospital, all staff shall follow contact isolation precautions that be keeping those infected in a quarantine facility to prevent further spread.
Public health goals. Because public health is a multidisciplinary job, it's expected that we will all work together to combat the issue. I've also proposed a few goals that are expected to come out of this, whether in a hospital or community center. Providing workshops, feedback systems, guideline implementation, and reporting systems. Potential implications for public health practice.
Antimicrobial resistance has many implications in public health, the most notable ones being higher medical costs, prolonged stay in hospitals, and an increased mortality rate. Due to more expensive treatments and greater uses of resources, AMRs can cost hospitals billions of dollars a year. In addition, AMRs reduce the effectiveness of treatments, which prolongs time spent in intensive care units. AMRs also increase mortality rates because they can compromise the patient's immune system, which leads to more complications and a higher risk of death. According to the CDC, more than 35,000 people die each year due to AMRs in the United States alone.